Welcome to our Introduction to the Cardiorespiratory Healthcare MSc. My name's Professor Morrell. I'm the course director.
And my name is Dr. Leanne Felkin. I'm the Senior Teaching Fellow on the MSc.
And we'd like to take a few minutes to tell you a little bit more about the MSc and also some of our graduates who have taken the course. So who are our students? These are some lovely photographs of our students at the British Lung Foundation stand with the little red balloon in the background at a conference that they attended. Our students are often healthcare professionals. They may be nurses, physios, but also people working as respiratory therapists, sometimes in pharmacology, sports science, etc. Or often they're sometimes new and recent graduates who've done other health related degrees, and it's really great to have everybody working together, sharing their expertise on the course. Some people have a specialism in respiratory and some people have a specialism in cardiac. So the next thing we're going to do is to tell you a little bit more about the programme itself. And if we give you a broad overview of what the programme covers first, we cover both cardiac and respiratory, and that is what makes our programme unique. And we also focus on the clinical application of the knowledge. So not necessarily the clinical practice, but the clinical application of the knowledge. We look at up-to-date research and we look at evidence-based practice. And we particularly are interested at Imperial College looking at innovation and how innovation and technology can improve healthcare. And we want to teach you skills that are going to make a real difference in healthcare and in your career going forward. We use a variety of learning techniques to do that. As a result of the pandemic, we've got multimodal delivery now, where we have experiential face-to-face teaching that might be in the lab or on campus, and then also we're able to provide guided online learning which you can complete in your own time. We have a fantastic array of clinical and research specialists who are able to come and teach you. We have our wonderful dedicated senior teaching fellow Leanne, who's going to tell you a little bit more detail about the course in a moment. And we use a range of assessment techniques really to allow you to showcase your knowledge and your skills. So sometimes we do poster presentations, for instance, or journal clubs, etc.
Right, thank you, Mary. So the next few slides will tell you a little bit about the programme structure, your research project, and also the timeline for your MSc. So in terms of the structure of our programme, we have 4 core modules, 3 elective modules, and a research project. Now, some students join us to do a PG Cert or a PG Dip, and the structure for those programmes are slightly different. And if you have any questions, please do email us. We'd be delighted to answer them for you. But I'm going to talk about the structure of the MSc. So in the MSc, you take 4 core modules. These are Foundations of Cardiovascular and Respiratory Sciences and Study Design. Then you complete the core module Reflection and Evaluation of Clinical Practice, and next is Quality in Cardiovascular and Respiratory Healthcare. Each student will choose 3 elective modules. You have a choice of 5 modules altogether. These are Innovations in the Management of Cardiovascular Disease, Acute and Community, and this is led by Professor Stuart Rosen. Cardiovascular Health, Prevention and Rehabilitation, and this is led by Dr. Luxi Anafin. Pulmonary Rehabilitation and Community Respiratory Care, this is read by Professor Nick Hopkinson. Respiratory Failure and Respiratory Support, which was led this year by Dr. Julia Kelly. And finally, Care and Management of the Adult and Child with Cystic Fibrosis, which is led by Dr. Sue Madge. So the core modules cover the core knowledge that we would like our students to come away with, and by choosing your elective modules you're able to tailor the MSc to your own interests and also to what you would like to achieve when you leave us following graduation. And then finally we have the research project. So just to spend a minute or two talking about the research project, it's a large part of the master's course, and research skills, in our experience, are one of the key skill sets that our students join us in order to learn. We're very lucky here. All of our research projects are led by academics at the National Heart and Lung Institute. And our projects come from both cardiovascular and respiratory fields, so you're able to choose a project which aligns with your own personal interests. Our projects can be clinical research, which means you may be collecting data from patients, or laboratory research for those of you who wish to do a wet lab project. We also offer systematic reviews of the literature, data analysis project from some of our research database or some of the national and international data registries. You can also look at service evaluation and improvement, and the types of methodologies we offer are both quantitative and qualitative. In terms of the timeline for your project, in December we release the project list, and you can select your project, and you may or may not wish to meet with some of the supervisors that we have. Our projects generally start around April, at the beginning of the Easter term, and that's when you can start your data collection, and the submission of the thesis is in August. And this slide shows you an example of the timeline for the MSc. We split the academic year into 4 terms, terms 1, 2, 3 and 4. In the first term, we start by inducting all of our students, both to Imperial College but also to the National Heart and Lung Institute. You will start your foundations core module and your study design core module. I will meet with you regularly for one-to-one meetings. We will discuss what elective modules you would like to choose, and we will confirm those elective modules, and towards the end of term 1 we plan to publish the project list. In term 2, we will begin the term by asking you to confirm your project choices, and then we will allocate those projects. You will start to engage in your assessments for study design and foundations, and you will begin the teaching for your elective modules and your assessments for those modules as well. I will meet all of our students again in term 2 for a one-to-one meeting to check on progress and how you're getting on with your project choices, and then we will break for the spring break. When we return in term 3, our projects will start. There is occasionally an assessment for one of the elective modules and a core module, but primarily your time will be focused on your project and your data collection, and your projects then continue into term 4. In term 4, there is some work for myself and Mary in terms of preparing for our exam boards. We hold 2 exam boards each year to ratify our students' marks, and then you will submit your project thesis and complete some other assessments for the projects before the academic year ends for you in September.
So we'd like to finish by telling you a little bit more about the career opportunities that your MSc might afford you, and on the next slide we've listed some of the activities that the college itself provides for you in terms of what you might be able to use as central college facilities. So there are careers fairs, there's lots of advice about how to apply for different roles and things. So it's really great that you've got the opportunity to tap into that research. And then if we let you know a little bit about where our students now are, we have a variety of students who've moved into clinical research, education and industry posts. We've been running for 3 years now, and we're really so excited about some of the new roles that our students have taken on. So thank you very much for listening to this presentation. I hope very much that it's answered your questions. If you've got further questions, please let us know, and we look forward to welcoming you on the course at some point in the future. Bye now.
Bye bye.